My name is Fiona Connally. I work for NorthWestern Mental Health AMHRU and I'm proud to be part of the Tackling Tobacco project. So I think the benefits, our client group already have a lower life expectancy because of their mental illness, other comorbidities, the medication we prescribe them, poor physical health. But adding smoking onto that reduces it again quite significantly. So anything that we can do to support them to reduce or quit smoking and improve their lifestyle, but their life expectancy as well, would be great. So it was done in several stages, and I suppose the first one was identifying what the gaps and needs were from both the staff and client perspective. And from that, training was a big one, so provided a lot of training to our staff. We've provided the resources that Quit have developed, so the brochures, just knowledge around the access to Quit line, that type of thing. So since Tackling Tobacco here at AMHRU, I suppose we've noticed a couple of key things, and the first one that comes to mind is the staff knowledge and confidence. That's the big one. Staff, and I walk along the corridor and I hear conversations between clients and staff about NRT, about do you want to ring Quit line, do you really want to go out for a cigarette, and before the project, that was very minimal. I can't say that I'd walked along and heard a conversation like that. And just the staff's confidence to be able to have those conversations, or to come and seek myself or one of the other champions who have done a little bit more training to support them and give them some advice. So for us, I think one of the biggest things is staff confidence and knowledge. So I think what's worked with the Tackling Tobacco project is, again, having that multi-dimensional approach. So first of all, targeting staff and better supporting them around their confidence and knowledge, so that then they can then impart that with the clients. But then also from the other side of it is offering things to clients such as smoke-free groups, having those conversations with them in our community meeting, displaying smoke-free information up on the boards that clients can see every day. There's one area around staff, and again it comes back to their knowledge and confidence. At the start of the project they were like, oh, but no one's ever quit. Clients they like smoking. How is this going to change the situation? So there was a little bit of resistance and reluctance on the staff part, but I think once they were given the toolkit, then that's certainly improved, and now people are a lot more positive about it, and they're also aware that it might not mean that people are going to quit, but they might, we can have those conversations, and it might mean that even if they reduce their smoking, that's an improvement. Sam is our peer support worker, and she's employed through Summit, which is our drug and alcohol service. So she comes here on a Friday and spends time with our clients. So she does a couple of things. She helps lead our community meeting, and she usually goes on the group outing. But essentially it's about supporting clients around their smoking cessation, having conversations, spending time with them, providing support, checking in, how are they going, and that type of thing. So surprisingly, clients are interested in quitting, in reducing, in having those conversations around that. I remember someone saying, I think it was someone from Quit earlier on in the project, that clients actually do want to have conversations about that. And we were like, really? No one's ever asked us about it, but if you initiate it, often they will want to have a conversation about how it's impacting on their physical health, or how much it's costing them, and what they can do about it. So as a client, I think they would notice that we're actually having conversations, the staff are having conversations with them about their smoking, offering them NRT, the doctors are having conversations with them as well. There's posters up around the building. I do a tackling tobacco tip of the week, and so that's up. And clients often approach me as I'm putting them up on the wall, on the board, and curious as to what it is. There's more, the activities are smoke-free, more of the activities are smoke-free, so there's more options for them. And like I said, it's on the agenda, so their community meeting, it's part of the conversation that's occurring, so I think that's a big change. We feel we have, and I think in broad terms, the increase in the uptake of NRT is a success, going from very minimal and maybe one patch on admission to combination therapy and using it more regularly. So that in itself is a success. Those conversations that clients are willing to have, again, is another success. We have had a few clients who have said they want to quit and have made attempts to do that, have run Quitline, have cut back their smoking. There's one client that stands out, and she has made really significant changes. So she's gone from smoking 20 cigarettes on admission to cutting down. I think she initially cut down to 10, which then cut down to 3 or 4 a day, and she's sitting on about 3 a day now, although when she goes home on leave she's saying that she's not smoking. So here often the boredom will make her, she has a couple of cigarettes, but she's using combination therapy. So she was our first client to use the mouth spray, and yeah, she's been really enthusiastic and very driven and motivated. And for her mainly it's around her physical health, but also the costs. So she's having driving lessons at the moment, and wanting to buy her own car. So that's a real motivator for her, and she's saving away for that, yeah. It surpassed our expectations of the project. I think we went in and we were happy to accept, whatever resources and supports were out there, not really having an idea of what the outcome might be, but to have someone to have such success, and just even that increase in NRT and the knowledge, and our doctors are involved and really open to those as well. So yeah, it's a great feeling. So first and foremost, just to give it a try. I think any information and education that you can provide to your staff will ultimately have some improvement in outcomes for your clients. I suppose a couple of the other things, having a really good relationship with your pharmacist is really important, just to make sure that all of the NRT options are available. Charting on medication charts is really important and can get really tricky, so having that relationship with your pharmacist is really important. I suppose around the training, just trying to get as many staff available for training, and then again having the champions. I think that's really worked for us, having some 5 key people that across different disciplines that are specialised in the tackling tobacco, so that they can support the rest of the team and drive things. Yeah. One of the things that's really helped us is having that executive leadership and support. So, our Director of Operations and has been a huge support and lead in this project, and really helped us to make it work. My manager as well has allowed me to lead the project and given me time to be able to attend meetings and do things like filming and training. Yeah, so I think that's really important, to have that drive and leadership from above that can then filter down and support the rollout.